Hello out there in television land. Welcome to yet another edition of It's Your Health. Philip Benyo with my bride. We're doing our Valentine Day commemoration, right, on this show? Just say yes, dear.
Is that all we're doing?
What else is there?
February 10th?
No, February 14th is Valentine's Day, sweetheart.
32 years?
Oh, that was my life sentence. You're right. Okay, well, we'll talk about anniversaries on the next segment of It's Your Health. We'll be right back after this brief commercial message. Check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back. Welcome to the first segment of It's Your Health, and of course, Valentine and anniversary commemorators or whatever.
Commemorations.
Very good, thank you. And who's that? Sammy
and Debbie,
wow.
And she is so beautiful.
Inside and out, terrific. Okay, so moving right along.
We'll start our headlines.
Please.
What is the current state of health and healthcare in the United States? Well, since 2022, they determined that a newborn in the United States was expected to live 77 and a half years.
And there was some concern that we've lowered our life expectancy with time, which is exactly the opposite of what you'd think. But the problem is, what is still taking us out? Heart disease, number one killer of men and women, followed by cancer, accidents, and believe it or not, COVID-19 is up there as well. And of course, we talk about strokes as well. So I'm not sure the reasons for going out of this world have changed, but we're a little bit concerned that we spend the most on healthcare, and maybe we're getting the least. So hopefully that'll turn around.
Well, if they claim it will, who knows? Anyway, that was our first headline, and here's the second one. Acute rhinosinusitis causes more than 30 million patients to seek health care per year. Respiratory tract infections, including bronchitis and sinusitis, account for 75% of outpatient antibiotic prescriptions. But may I add, sinus fluid that's available for culture, only 1/3 of those diagnosed with rhinosinusitis grow a bacterial pathogen, so they're getting the antibiotic for nothing.
Perhaps. Everybody has a head cold that doesn't go away. They want an antibiotic. It simply could be a viral thing. Viruses kind of stick around a little bit, but if you're blowing out yunky stuff, you have sinus pain and fever, that may be an indication for an antibiotic. I use what's called transillumination of the sinuses. You can put a flashlight here and see if you can see the flashlight. If you can't, then there's probably fluid on your sinuses, which can maybe lead to an x-ray and a proper diagnosis and treatment.
Speaking of sinusitis, I was sick, and he said to me, "You have a virus. I'm not giving you any medicine. You'll be better in 5 days." 5 days later, I was better.
Yeah, it must have been the chicken soup I made.
It could have been, because that was delicious.
Very good.
The dogs loved it. Okay, our next headline, ACE inhibitor or ARB therapy can prevent diabetic kidney disease progression. Use of ACE inhibitor or ARB reduces progression to end-stage kidney disease in patients with diabetic kidney disease, so it helps them.
Right. ACE inhibitors are like lisinopril. They are used to treat blood pressure. ARBs are like valsartan. And I kind of like the ARBs rather than the ACEs, because the ACEs, 10% of the time, you can end up having a side effect of having a cold all the time, cough, congestion. We get rid of the ACE inhibitor, it goes away. But nevertheless, ACE or an ARB protect your kidneys. So if you're diabetic, you should be on one or the other.
Do we know what ARB stands for?
Angiotensin receptor blocker. I'm sorry, sweetheart.
Wow.
I say ARB.
Okay. Inclusion of dental services in Medicare to improve oral and general health for older Americans. And don't get excited, they don't mean Medicare A and B. That's not counted. Poor oral health negatively impacts overall health, quality of life, and well-being. Increasing evidence suggests that provision of basic dental care for elderly Americans would improve outcomes for a variety of systemic diseases and reduce the overall cost of health care. As a result, recent changes have been implemented to include some dental benefits in some Medicare programs.
Yeah, it's too bad we don't have dental care because that's when you need it. When you're a little older, dental health parallels your other health. So if you have bad teeth, you're going to have bad health in other areas as well.
If your gums are bleeding,
Yes, not
something's
good.
up. Potentially inappropriate medication use and polypharmacy before and after admission to internal medicine for older patients again. With the aging of the population and the increase in chronic diseases, there is an inherent risk of polypharmacy and inappropriate medication use. The prevalence and incidence of potentially inappropriate medication use and its correlation with polypharmacy. That means too many medicines.
Well, you're on a laundry list of medicines. You go in the hospital, you may get new ones. They may subtract some. And so
They may add some.
that's sort of the danger point where you come back home and you're really not sure what you should be taking. And that's why we generally like to see patients within 7 to 14 days following a discharge from the hospital to go over this laundry list, make sure nothing got added or subtracted that shouldn't have been.
I'm going to ask you a question that somebody asked me. Is it true that you make house visits?
Yes, it is.
So when you say to see somebody within 7 to 14 days, what if they're not well enough yet to go into the office?
Well, our patients call us and we set up times. I specifically have taken virtually every afternoon off to
He's not off.
to do other work such as go to personal care homes, nursing homes, and home house call visits.
Wow, I bet you're one of the few. You're like a dinosaur.
At least I know where my home is.
Oh, do you?
Is that right?
I hope so. Okay. And when we talk about that, we talk about caregivers for people who come home from the hospital but still need care, and it's the older brother or sister or relative who takes care of them, and that leads to caregiver burnout. And you know you have it if you withdraw from your friends or family, if you lose interest in things you like to do, if you're feeling blue and maybe even cranky, your appetite changes. You're more hungry or you're not hungry at all. Same thing with sleep. You're more sleepy or you don't want to sleep. You get sick more often. You're exhausted. You're using alcohol and sleep medications. And you want to either hurt yourself or the person you're taking care of. How can we prevent this?
First of all, get help. Recognize that caregiver stress is out there and you're virtually running a nursing home in your home. And truth be told, I suffer from caregiver stress, right, sweetheart?
Taking care of those two dogs tires you out, doesn't it?
Exactly. We'll be right back after this brief commercial message. You're watching It's Your Health. Hey, please give our sponsors a call and say, I heard it on It's Your Health, and better yet, use their services. We'll be right back. Welcome back to the second segment of It's Your Health. What a picture there, Sammy. And as they say in politics, are you better off now than you were 22 years ago?
You better say yes.
All righty.
You're
Good.
so lucky to have Lori.
Absolutely. And we're happy to have Sammy, too.
We love Sammy.
Absolutely.
Okay. Are you ready for a headline?
Please.
Okay. Fluoroquinolones are widely used drugs around the world. It's a result of their broad spectrum of antibacterial activity and known efficacy, means that they work. Since they appeared on the market, their prescribing frequency has increased. It became the third most prescribed class of antibiotics in the U.S. 10 years ago. Widespread use of these drugs resulted in side effects. Mental disorders in the form of anxiety, psychotic symptoms, insomnia, and depression. What's the story with that?
Well, the fluoroquinolones, namely Cipro, Levaquin, powerful antibiotics. They do cause central nervous system and psychiatric side effects. I kind of like to avoid them in the elderly, especially if you're on other medications. But if you're on Cipro and Levaquin, be mindful of those side effects.
Like confusion, irritability. That's like being around you.
Wow. Cool.
Insomnia, seizures, psychosis.
I think we're due for the second headline, sweetheart.
Mania. All right, I'm getting there.
Homicidal to spouse? Is that?
Oh, ha, 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 ha. Second headline. Hypertension in obesity. Interesting. Impact of miscuffing in blood pressure measurement. We should know that people, depending on the size of their arm, may need a different size cuff. I should have a small cuff.
You are petite, that's true.
Yes, but I don't always get that.
What, the small cuff?
Yeah.
Okay. Well, in either event, it's a good point. You put a small cuff on a large arm, you're going to get an inappropriately high blood pressure. And so make sure if you're taking your blood pressure, you have an adult-sized cuff. They come in several sizes, so just check with your healthcare provider or pharmacist.
A regular size fits 51% of adults, and 40% need a large size. 3% need an extra large. They didn't mention small ones. Okay, nearly 70% of adults are either overweight or obese. U.S. obesity rates have tripled over the past 60 years, and severe obesity, also called morbid obesity, has risen 10 times.
Big healthcare problem manifested in diseases such as hypertension, diabetes, stroke, heart attack, increased risks of sleep apnea. Probably it's our lack of activity coupled with processed foods. So hopefully in the coming years, we're going to be able to combat that.
Well, I sure hope so. And yeah, processed foods, that's a big thing now in the news.
Right.
Okay. Believe it or not, we have a headline on COVID. You would like to think that's over, but it's not. It's an illness caused by the severe acute respiratory syndrome coronavirus 2. Symptoms may persist after recovery from the acute illness.
Look at this one picture of 33 different symptoms attributable to COVID-19. Everything from, at the top, loss of taste and smell, and at the bottom, post-exercise malaise, which is probably the biggest one. So it's really out there, and it's hard to tease out what symptoms you're having after COVID, because there's little in the way of treatment for it, because it's something that we're stuck with.
Does it ever go away?
Who knows? I mean, the COVID's been out a couple of years, and we still have this issue. We still have COVID, so I don't know if it's going to go away or not.
Wow. Okay, let me go to the next, well, it's not a headline. Statin therapy, inflammation, and outcomes in patients hospitalized for COVID-19. There was a study. What did it tell us?
It told us that the anti-inflammatory properties of statins, which we kind of knew about all the time.
Tell us again what statins are.
Statins are medications to reduce cholesterol, like Lipitor, Crestor,
Okay.
Zocor. If it ends in a core, it's probably a statin. So anyway, we did know that it cut down on inflammation of our arteries, lowering the stroke and heart attack risk. Some of the statins have a better activity rate with regards to C-reactive protein and inflammation than others. But nevertheless, they are anti-inflammatory. People hospitalized with COVID on statins did better, probably because of that.
Wow.
Probably. But you know, statins are controversial. They have their own set of side effects. People kind of say, well, I'm not sure I want to do that, but they ought to consider it.
They make my sister sick. She doesn't like them. Okay, now we're going to talk about, speaking of sisters, about women. Conditions that impact women. And the first one should be men. Most of our conditions are caused by men.
Sweetheart, we're dealing with facts here. We can't be taking editorial liberties here, okay?
I am not doing that, because the first one is anxiety. Women are twice as likely as men to be diagnosed with an anxiety disorder. Autoimmune disease, when the body's immune system goes into overdrive and attacks its healthy cells, like lupus, rheumatoid arthritis, celiac disease, diabetes, and multiple sclerosis. Breast cancer. It's possible in men, but seldom. It's 100 times more often in women. Broken heart syndrome. There really is such a thing?
Yes, there is. We see it all the time. If you had a stressor activity, even if you're generally healthy and don't have coronary disease, you can have a cardiac arrhythmia, you can have a heart attack. Broken heart syndrome is out there.
Oh dear. And then there's depression. That goes back to men carry that.
Okay, next topic, please.
Irritable bowel syndrome, digestive complaints, migraines.
Yes, and again, it's more something we see in women. Perhaps it has to do with caffeine intake, heredity, maybe their cycle, things like that.
Osteoporosis, get your DEXA scan. It doesn't cost anything. Stroke, thyroid disease, trichotillomania. That's a new one. Pulling out your hair. Urinary tract infections, because women are more apt to get them than men. Again, because of men.
Okay.
So I think we're supposed to finish this part up.
Yes.
I don't think Sammy wants to hear this.
I don't know. Well,
okay.
I'm.
We'll see you in just a minute for the next section of It's Your Health.
Please come back. Welcome back, thank God, to the final segment of It's Your Health.
You look at the picture. Do you know who that is?
Give me a hint.
Oh, come on. We were young and in love, and my mother took that picture of us.
Oh, my God. God bless her soul.
I know, that was so long ago. Oh,
And
those
so-
were the days.
And nights. Okay.
True. I better not talk about that. This is the first headline for this section, but it bothers me. How many people in our country get colon cancer? And that bothers me because I know there are ways to try to avoid that or stop it.
Screen for it, is what you're saying.
Sure. Colorectal cancer is estimated is the fourth most common cancer in men and women, and the second leading cause of cancer-related deaths. Second.
And it's very common in our area, and we're seeing it in the younger folks as well. We used to say wait till 50 to get your colonoscopy.
Not anymore.
It's down to 45, and maybe actually earlier if it runs in your family. And so get screened for colon cancer. I mean, it's something that we should not be talking about.
It's no fun, but it's important.
Absolutely.
Next headline. How many Americans have diabetes? Almost 30 million people have a diagnosed case, and almost 9 million are undiagnosed. 38% of the adult population are estimated to have pre-diabetes?
Again, it goes
Oh, my
back to
goodness.
the obesity epidemic, and the fact that if there's more of you, there's going to be more of you having diabetes, and more importantly, undiagnosed diabetes and pre-diabetes.
This next headline is just repeating what he always says. Food is medicine. The time is now. Society globally endorses a plant-forward diet, lower in fat and processed foods, whole grain foods, and mostly fresh foods. And you've been saying that.
Right. Well, I grew up in a food environment, Andy's Market on 10th and Locust in Hazleton years ago. And so we always cooked on our own. We stayed away from processed foods, and I have a couple of recipes from there, like coleslaw and potato salad.
Oh, people will steal that from you.
They have to marry me. Go ahead.
You won't give it to me.
Okay.
Okay, let's go to the next one. Run through this one. The top 10 health conditions that have the greatest impact on quality of life.
Okay, here we go. Hypertension. 12% of people out there can be impacted by high blood pressure. The silent killer. We are worried about diabetes, strokes, and heart attacks.
Get your checkup.
Major depression. I don't have to tell you about that. It's been a tough go of it, particularly after COVID. 9% out there. We're worried about constant sense of hopelessness and despair, making it difficult to work, sleep, or eat. High cholesterol dovetails with what we've talked about earlier. Coronary artery disease, blockages of the heart leading to heart attacks. And diabetes, again, this sounds like a recurrent theme, doesn't it?
Type 2.
Substance abuse disorder, impacting our health. We have a big problem with overuse and dependence on prescription medications. COPD, a big healthcare concern. Smoking, of course, is the cornerstone of that. Psychotic disorders, again, dovetailing with our mental health, where you can get someone who just kind of snaps. And Crohn's disease, ulcerative colitis, out there more than you think. Again, it kind of dovetails with perhaps things like stress and anxiety, things along those lines.
Men.
Where you're, oh, we're going back to men again. All right. Talking about men, tell us a little bit more about men's health.
I really don't want to, but blood in the ejaculate is alarming to patients, but it's almost always benign. It's called hematospermia. Often resolves on its own.
Yeah, sometimes can be due to infection, very alarming, but nevertheless, you should get a urologic evaluation, but it generally is a benign condition.
And if you've been to somewhere like Africa or Asia or China and you had some water that had worms in it,
Oh,
that
not
would
good.
be bad.
That would be bad.
Okay, next one.
Yes, ma'am.
Advise patients taking SGLT2 inhibitors that the medication is associated with lower urinary tract symptoms and risk of urogenital infections. I don't know what that means.
That particular medication is used for diabetes. What it does is it lowers the threshold for which you spill sugar in your urine, lowers the blood sugar that way. You can actually pee out about 2 candy bars worth of carbohydrates a day. That increased sugar load can lead to frequency of urine, and particularly in women, bladder infections.
Always in women.
It's not our men's fault.
I don't know how they do it.
Is that right?
Okay, are we doing the types of female health disorders?
Quickly.
Premenstrual dysphoria disorder.
Well, I guess pregnancy is another one that we don't have to deal with, right?
Exactly.
And of course, people should be reminded, just like their car gets an inspection sticker after a year, girls out there in television land should also get up-to-date GYN exams. Am I right or not?
Absolutely.
Okay.
Along with their DEXA scan. Postpartum depression, it doesn't mean they don't love the baby. It means that they're having a hard time adjusting. Hot flashes, depression, irregular menstruation, insomnia, mood changes, and weight gain.
All right, what else do we have to talk about, sweetheart?
I brought something along.
Oh, my heavens.
Yes.
My favorite movie.
It is. It is my favorite romantic movie. It's called Up. And if you haven't seen it, You must see it. And this is for us, for our
We're
anniversary.
going to get in our balloon and go up?
No, I don't think so, but we got this, babe.
Okay. Thank you. And we got you, babe, on It's Your Health.
Yep.
Appreciate your allowing us to come into your home, entertain, and inform you, right? Make sure you check with your healthcare provider and call our sponsors and utilize their services, please, because that's
And
why
watch us on the internet also, not just on television.
Yeah, I'm not very internet involved, but if you say so.
It's true.
Yes, dear.
Sammy taught me.
Okay. All right, thank you and take care.
And happy Valentine's Day and happy anniversary.
Be safe.